You show up to the emergency room without insurance and without money, and you're terrified they'll turn you away or demand payment before treating you. Here's what's legally guaranteed and what hospitals do anyway, regardless of the law. Because the gap between what's legal and what actually happens is where hospitals exploit people in their most vulnerable moments. There's a federal law called EMTALA, the Emergency Medical Treatment and Labor Act, that was supposed to solve this problem. It says hospitals that accept Medicare funding must stabilize all emergency patients regardless of ability to pay. No deposit required, no insurance card needed, no ability to pay assessment before treatment. The law is clear. If you're having a medical emergency, the hospital must treat you first and deal with billing later. Here's what hospitals legally cannot do. They cannot require you to pay before receiving emergency care. They cannot demand a deposit or proof of insurance as a condition of treatment. They cannot refuse to stabilize you because you can't pay. They cannot discharge you while you're still medically unstable just because you're uninsured. They cannot ask about your ability to pay while you're actively being resuscitated from a heart attack. They cannot turn away a woman in active labor. They cannot refuse to treat a stroke patient because they have no insurance. EMTALA is actually pretty powerful. Violations can result in hospital fines up to $65,000 per violation. Federal funding can be pulled. Lawsuits can be filed. On paper, the law protects you. In reality, it's more complicated. Here's what hospitals legally can do. They can require payment for non-emergency services. They can bill you for treatment. They can send your bill to collection agencies. They can report unpaid medical debt to credit agencies. They can place liens on your home. They can pursue judgment against you for unpaid balances. They can garnish your wages. They can refuse to provide non-emergency care if you have an outstanding balance. So the law says they must treat your emergency, but they can make you pay for it afterward. And if you don't, they can pursue aggressive collection practices. This creates a situation where hospitals follow the letter of the law while still financially destroying people. The first thing hospitals do that's borderline legal is ask about your ability to pay even after treatment begins. The law says they can't ask before stabilizing you, but once you're in a hospital bed, suddenly there's a financial counselor asking about insurance, income, and ability to pay. You're still in crisis, still processing what just happened, and someone's asking about money. It's technically legal, but it's predatory timing. The second thing hospitals do is admit you for a short stay, then discharge you prematurely because you can't pay for longer hospitalization. EMTALA requires stabilization, but it doesn't require treatment to completion. You're stabilized and discharged, even though optimal care would be longer observation or treatment. You're sent home partially recovered because the hospital knows you can't pay for extended care. Here's what they always do. They bill you for the full amount regardless of whether you can pay. A 3-day hospitalization could generate bills exceeding $50,000. They know you can't pay it. They bill it anyway. Then they sell the debt to collection agencies or pursue it themselves. The third thing hospitals always do is bury financial assistance information so deeply that most patients never find it. Federal law actually requires hospitals to have charity care programs and financial assistance available. Most people don't know this exists. Hospital websites have financial assistance information buried in footer links or behind multiple pages of small text. They're technically complying with the requirement to offer it, but they're doing everything possible to make sure people don't actually access it. Here's what's infuriating. Many patients qualify for financial assistance that would reduce or eliminate their bills, but they never know it exists because hospitals don't advertise it. A patient without insurance might qualify for 100% charity care, but they're not told. They're sent to collections instead. The hospital fulfilled its legal obligation to have a charity care policy, but didn't actually help the patient access it. Fourth thing hospitals do is separate billing to maximize what you owe. Your emergency room visit is billed by the hospital facility. The emergency room doctor is billed separately by a private company. The lab work is billed by a different entity. The imaging is billed separately. You receive bills from 6 different organizations, each one demanding payment, creating confusion about who to pay and what you actually owe. This fragmentation is intentional. It's harder to negotiate with 6 different billing entities than one hospital. It's easier for collections agencies to pursue smaller individual debts. The law doesn't forbid this practice. It's legal. It's just predatory. The fifth thing hospitals always do is report unpaid medical debt to credit agencies, destroying your credit even though medical debt is supposed to be handled differently than other debt. You survived an emergency, you needed life-saving care, you couldn't pay for it, and now your credit is destroyed for years. This affects your ability to get loans, housing, employment, all consequences of having had a medical emergency. Here's what changed recently. New rules limit how aggressively credit agencies can report medical debt, and there's a 2-year waiting period before medical debt can be reported. But hospitals are still pursuing it aggressively, and many people don't know their rights regarding medical debt on credit reports. If you're learning what hospitals can't legally do but do anyway, hit subscribe. We're breaking down the laws designed to protect you and how hospitals work around them. The sixth thing hospitals do that walks the line between legal and predatory is pursue wage garnishment aggressively. They have the legal right to garnish wages for unpaid medical debt. What they don't advertise is that you can often negotiate payment plans, request hardship exemptions, or access charitable care to avoid garnishment. They pursue garnishment first and only mention alternatives if you fight back. Here's the cruel math. You're working a minimum wage job. You had a medical emergency. You can't pay the $30,000 bill, and the hospital garnishes your wages. Now you're making even less. You can't pay living expenses. You default on other bills. Your life deteriorates further. The hospital is within legal rights to do this, but it's devastating to people already struggling financially. The seventh thing hospitals always do is wait until you're in crisis to address billing. If you had a surgery scheduled in advance, they could address payment before the procedure. Instead, they wait until you're admitted for an emergency, treat you, and then hit you with bills. The timing ensures maximum financial vulnerability. Here's why they do this. EMTALA requires emergency treatment regardless of ability to pay. If they address billing before treatment, they might feel obligated to provide less care, or they might face patient refusal of care. It's easier to treat first and bill aggressively after when you're already emotionally and physically drained. What hospitals legally can't do is turn you away from the emergency department because you can't pay. What they can and always do is treat you, then pursue you aggressively for payment through billing, collection agencies, credit reporting, wage garnishment, and liens on property. They're required to stabilize you, but not required to do it gently or to inform you of financial assistance available. The law protects your access to emergency care. It doesn't protect you from financial devastation after receiving that care. It doesn't require hospitals to tell you about charity care. It doesn't prevent aggressive collection practices. It doesn't stop wage garnishment. It doesn't forbid fragmented billing that confuses patients about what they owe. Understanding what hospitals can't legally do helps you protect yourself when you can't pay. Know your EMTALA rights. They must treat you in emergency situations regardless of insurance or ability to pay. Know that charity care programs exist and you can request them. Know that you can negotiate payment plans and request financial hardship considerations. Know that wage garnishment can be challenged. Know that medical debt credit reporting has changed. Know that you have rights, even if hospitals don't advertise them. What hospitals legally can't do, and what they always will, reveals the gap between law and practice. The law says you'll get emergency care. The hospitals ensure you'll pay for it, one way or another, through billing, collection agencies, credit damage, and wage garnishment. The law protects your immediate survival, but not your financial survival. And that's the loophole hospitals have mastered.